It is not uncommon to be speaking to patients or for you to be out in the community speaking to people you know who say, "Oh, I have so much more pain, it's heck getting old." Or, "Oh, this part of my body doesn't function well anymore, it's heck getting old." Is it really all due to getting old, or are there underlying disease processes associated with it? I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Now, there is normal physiologic senescence with aging. So basically, as we age, we physiologically get less efficient at multiple processes, and our organs start to turn over from good, healthy tissue to fibrotic tissue, and so on. There's some normal aging, but oftentimes the people saying, "Oh, it's heck getting old," are in their 40s and 50s. That is not old enough for the normal senescence to be happening, but that is old enough to have lived an unhealthy lifestyle long enough to have things that you would blame on aging that aren't true. When we're talking about the physiologic senescence or the quote-unquote normal aging, we're talking more about people aged in their 70s and 80s. Well, today I want to show you how the research talks about normal aging or the effects of normal aging on the geriatric population, and then alert you to some drugs that may speed that aging or may worsen the effects of that aging and may lead to dementia and depression and things like that. So let's dive in. So this is a 2008 study from the journal Current Opinions in Clinical Nutrition and Metabolic Care, and they're looking at the clinical significance of gastrointestinal changes with aging. So the GI tract changes as we age. And a very important quote that we want to pay attention to is right here. Although many of the physiologic changes of the gut are relatively minor, these small changes can place an older person at a major disadvantage when they are exposed to a disease process. So some of these changes are so minor that you may not notice them symptomatically, but because they are minor, and if you add up a bunch of minors, that can result in a major issue if you're then exposed to a disease process at the same time. So maybe it's not a big deal if you're totally healthy, but if you're an unhealthy geriatric and you're having these normal effects of aging occur, then it makes your disease process worse. So what are some of these normal aging effects? Well, we have increased gastrointestinal reflux because with aging there's decreased stomach acid production. So with decreased stomach acid production, we're having poorer protein digestion. So undigested protein drives inflammation, bacterial fermentation, maybe gas, bloating, reflux, those sorts of issues. Decreased stomach acid production with aging could also lead to decreased vitamin B12 absorption. So this study from 1999 is showing you B12 deficiency increases with advancing age, partially because the elderly have decreased stomach acid production here as hypo or achlorhydria, and so lower stomach acid production, lower intrinsic factor, lower B12 absorption. Well, poor B12 absorption can lead to neurocognitive effects such as anxiety, depression, and it's been related to dementia and Alzheimer's. Other changes. Thickening of the colon wall can lead to increased risk for diverticulitis in the elderly. Decrease in the ability of the GI tract to absorb vitamin D puts the elderly at increased risk of vitamin D deficiency, especially because they're less mobile and they're more clothed. So even if they're out in the sun, they're getting less vitamin D exposure. And vitamin D, as we've talked about multiple times in the past, is very important for immune function, for bone health, as an anti-inflammatory, all things very important for geriatrics and maintaining lifespan and longevity. You also have decreased motility in the gut, so more constipation, more potential for fecal incontinence. All of these things lead to suboptimal function. And lastly, you have poorer liver function. So if the average geriatric is on 13 medications in the United States, that's a large toxic burden that needs to be detoxified by the liver. And if we have suboptimal liver function, that's not happening as well as it should and can lead to increased toxicity in the elderly patient. So as we look in this study further, they have a nice table showing the effects of aging on absorption of nutrients. And you can see here that very key nutrients absorptions are decreased with aging. We have decreased vitamin B12 absorption if there's atrophic gastritis present, which is not uncommon in the elderly. You have decreased calcium absorption. That can play into bone health, osteopenia, osteoporosis, and fractures, which are a big cause of death for the elderly. Decreased zinc absorption, magnesium, and iron. So all of these play into bone health, but then zinc is very key in immune function. Magnesium is very key in cardiovascular function, muscle contraction, all kinds of things. And iron is very important in carrying oxygen and providing energy for our elderly. It's very important as a cofactor for neurotransmitter production, so affecting mood, depression, anxiety, all of those factors. So we want to make sure our elderly are not only eating properly and eating healthy foods, but they need supplementation as well, because even if they're eating the best organic non-GMO foods, their ability to absorb those nutrients is decreased due to aging. And then you pile in disease processes, and that will decrease their ability to absorb it even further. So we just want to say, again here, they say in the conclusion, many of the changes are small, but can amplify disease processes seen with aging. So a lot of little things can add up to a big thing. So now if we go over to this study from 2017 in the International Psychogeriatric Association, they looked at the risk of proton pump inhibitor use and its association with depression. And they looked at an elderly population, and they found that the higher the proton pump inhibitor doses were, the higher the risk of depression. And they found that 14% of depression cases in the geriatric population could be avoided by withdrawal of proton pump inhibitor prescriptions. So proton pump inhibitors are used for gastric, for GERD, for acid reflux, for gastritis. So we want to think about in these patients, if we're giving, or if they're being prescribed PPIs, the risk of depression. PPIs are associated with dementia and Alzheimer's. They're associated with kidney dysfunction. They're also associated in this study down here, it lists, they are associated with increased risk of adverse outcomes, including osteoporosis, fractures, and mortality. Those three go together because if you're osteoporotic, you're at higher risk for fracture. The elderly, it's not uncommon to fall, have a hip fracture, go to the hospital, pick up an infection, and pass away because of that. All could be tied back to being on a PPI drug. So it's very important to understand physiology of aging and how that normal aging could result in disease processes or contribute to worsening of disease processes, and how it could also result in that person being prescribed a drug, which could then worsen these cases or set them up for increased risk of mortality. So again, from a functional medicine perspective, we want to understand that there are normal effects of aging. We want to understand how can we support that person to oppose those normal effects, like say a multivitamin would be super key for a geriatric patient. Knowing drugs that could exacerbate those things and maybe avoiding those, like a PPI exacerbating depression and dementia in an elderly patient. If there's signs of depression, you probably don't want them on a PPI. If there's signs of forgetfulness and dementia developing or a family history of it, you probably don't want them on a PPI. And you probably want to supplement vitamin B12 for the elderly. So remember, aging is normal, but the effects of aging that our society blames on aging truly don't occur till the 70s and 80s. So if you're in your 40s and 50s and having issues and blaming it on aging, it's not the aging, it's the lifestyle. So you need to look and observe at your lifestyle and decide, hey, how can I change my nutrition? How can I change my physical activity, my stress levels, my sleep? What testing can I get to see what's going on under the hood and correct these things? And that is the functional medicine approach. That's what we do every day at Functional Medicine Charlotte.